The bandages demonstrated in this video include the modified Robert Jones bandage, the fortified Robert Jones bandage, the spica splint, the closed toe bandage, the full limb cast, and the Robert Jones bandage. The first step in the application of most bandages, including the modified Robert Jones, is the placement of tape stirrups to prevent the bandage from slipping. Cotton is then placed between the toes to prevent pressure sores. The distal ends of the stirrups are folded over and the stirrups are temporarily stuck to each other or to a wooden tongue depressor. A layer of cotton or cast padding is then applied beginning at the toes and working proximally. The middle digits are not covered so that they may be inspected for evidence of swelling or impaired circulation. Failure to cover the other digits will result in unwanted swelling of the digits secondary to venous congestion. Gauze stockinette may be cut and rolled into the shape of a donut. The donut is then placed over potential pressure points. The cast padding is continued with each pass overlapping the preceding one. Two to three layers of cast padding are sufficient for this bandage. A layer of conforming roll gauze is then applied in a similar manner. This layer is applied with light and even tension to avoid undue pressure at any one point. Once the gauze layer has been applied, the tape stirrups are separated, rotated, and reflected proximally to adhere to the gauze. A final layer of vet wrap or elasticon is applied beginning at the toes and working proximally. When finished, the properly applied modified Robert Jones bandage has a smooth, uniform appearance to it. The tape stirrups, cast padding, and conforming gauze layers of a fortified Robert Jones bandage are applied in an identical manner to the modified Robert Jones bandage. However, prior to placement of the final bandage layer, splint material is incorporated into the bandage. A spoon splint may be applied to the palmar or plantar aspect of the limb. Fiberglass casting tape may also be used on the palmar surface if prefabricated spoon splints are not available. Rigid materials such as yucca board or aluminum splint rod may be applied laterally. These aluminum rods are available in several diameters and are easily bent to conform to the shape of the animal's limb. The rod is cut as needed with bolt cutters, and the ends are bent away from the animal to prevent abrasion. The splint material is covered with an adherent layer of elasticon or tape to prevent migration of the splint that may occur if vet wrap is used as the final layer. Alternatively, fiberglass casting tape may be applied laterally beneath the final layer of a fortified Robert Jones bandage. The casting tape is removed from its package immediately prior to use. Exam gloves are worn to keep the resin within the tape from sticking to your hands. The fiberglass is thoroughly soaked in warm water and then squeezed to remove excess water. An assistant holds the ends of the casting tape as it is rolled back and forth. If the casting tape is applied so that it covers the entire lateral surface of the limb, the fortified Robert Jones bandage is also referred to as a lateral half cast. A layer of conforming roll gauze is applied over the fiberglass so that it conforms to the shape of the animal's limb as it hardens. The proximal end of the fiberglass may need to be folded outward to avoid the development of pressure sores. The fiberglass is allowed to harden for several minutes. The final layer of elasticon is applied from distal to proximal as previously described. The rigid fiberglass shell is easily removed and reapplied at subsequent bandage changes. The spica splint is essentially an extended version of the fortified Robert Jones bandage. The distal limb is prepared as described for the modified Robert Jones bandage. A cast padding or roll cotton layer is then continued proximally to provide padding over the humerus, scapula, and spine. The cast padding is passed behind and in front of the opposite limb and between limbs to prevent shifting of the bandage materials. An assistant helps make this process much less labor-intensive. When the shoulder area is well padded, conforming roll gauze is applied in a similar manner. Fiberglass casting tape is prepared as before and rolled out from the toes, over the lateral aspect of the limb, over the shoulder and spine, to the level of the contralateral scapula. Several layers of fiberglass may be required to attain sufficient rigidity. Alternatively, aluminum splint rod may be cut, bent, and applied in a similar manner. Conforming roll gauze is applied before the fiberglass hardens. A final layer of elasticon or vet wrap is applied over the hardened splint to complete the bandage. The closed-toe bandage is the only bandage which covers all of the digits. Since the toes are not visible and available for inspection, frequent bandage changes are mandatory. When beginning a closed-toe bandage, cotton, non-adherent dressings, or debriding materials are placed between the toes, depending on the status of the soft tissue injuries involving the digits. Tape stirrups are applied if possible. Extensive skin loss may, however, preclude their use. Cast padding is applied over dressings from distal to proximal. The tape stirrups are reflected. Cast padding is then applied in a back and forth manner to cover the digits. Another layer of circumferential cast padding may then be applied. A layer of conforming roll gauze holds the cast padding in place. The closed-toe bandage is completed with a layer of vet wrap or elasticon, which also covers the toes. Rigid external fixation with a full limb cast is achieved by applying fiberglass casting tape over a thin layer of cast padding. Tape stirrups and interdigital padding are applied as previously described. Stockinette is cut to an appropriate length. There should be an excess of stockinette at both ends of the cast. The stockinette is rolled upon itself and then unrolled to cover the limb. Any wrinkles in the material are eliminated to prevent pressure sores. One layer of cast padding is then applied from distal to proximal. Rolled stockinette may be used to pad areas that could potentially develop pressure sores. The fiberglass is soaked in warm water, wrung out, and applied from distal to proximal. Once again, only the middle digits protrude from the bandage. The distal stockinette is reflected proximally and incorporated between fiberglass layers before proceeding. Overlapping layers of casting tape are applied with just enough tension to eliminate any wrinkles in the material. 2 or more rolls of fiberglass may be required to attain sufficient rigidity. The proximal stockinette is reflected distally and incorporated between fiberglass layers so that direct fiberglass to skin contact cannot occur. Once the fiberglass has hardened, the tape stirrups are reflected. A final layer of elasticon is applied to finish the cast. Removal of the cast is accomplished with an oscillating cast saw. The saw is guided through the lateral surface of the cast with both hands. This gives the operator more control over the saw and prevents saw-to-skin contact. The saw will not cut skin, however, tearing of skin trapped between the cast and bony prominences can occur. A similar cut is necessary along the medial surface to allow easy removal of the cast. The Robert Jones bandage, as with all other bandages demonstrated in this video, begins with the application of tape stirrups and interdigital padding. Several layers of bulky roll cotton are then applied beginning at the toes and working proximally. The cotton as it comes off of the roll is too wide to be applied easily to small animal patients. Therefore, the cotton is unrolled, torn in half, and then re-rolled prior to incorporating it into the bandage. After applying several layers of roll cotton, the cotton is compressed with wide conforming roll gauze. Using narrow roll gauze will result in a lumpy bandage with uneven distribution of pressure. Significantly more tension may be applied to the gauze than when applying a modified Robert Jones bandage because of the large volume of roll cotton between the limb and the gauze. The stirrups are reflected and stuck to the gauze. A final layer of vet wrap or elasticon is applied. Once again, the middle two digits are available for inspection. When finished, a properly applied Robert Jones bandage should be rigid and will resonate when thumped, similar to a ripe watermelon.